This is NTA Channel in Lagos, Station for Excellence, and you're still watching the Sunday show, your Sunday Dara Prem. Where else would you rather be? And we're happy you're enjoying yourself, because that is why we are here, and that's why we have this program. Well, that was your Pato community, so they are launching 150 million Naira Civic Center to help their community. And now we are going to talk health. Cancer is on the increase, especially in this part of the world. The physician will tell us that cancer happens when cells just go haywire, when they stop obeying. All right, so we'll specifically look at breast cancer today and then see what's happening in the world of breast cancer, whether there could be the possibility of someone getting cured or getting better treatment, especially in this part of the world. And I have Dr. Femi Ogunremi as my guest. He is a medical practitioner. He's also a medical educator, and then he has won awards both locally and internationally. And then, even as young as he is, he's very cultivated in the world of medicine. So, Dr. Ogunremi, welcome to the program.
Thank you.
Now, but it's sad that what we're going to talk about is what kills at least about 120,000 women every year, and is on the increase. All right, so, and that is breast cancer. So to a vegetable seller, to meat seller, to an amala seller, how would we describe breast cancer?
Okay, thank you so much for having me here. And I think to talk about breast cancer, I think it's better for us to just generally talk about cancer so that people can understand. Cancer, just like you said earlier on, is said to happen when the cells of the body, which normally they undergo some processes, just like we as living being, you live for a period of time, and when the time expires, then somebody is said to die. So a normal cell in the body will go through process like that as well. So when a cell happens, let's say when it's been formed, these cells will have a period of time they're supposed to live, and then it will die. That's the normal process.
Yes.
So what then happens in the body is, for some reasons that we still don't understand, some of these cells, they just start
misbehaving.
They misbehave. And that misbehavior will be such that they refuse to die. A programmed death that is supposed to be there, they won't die. And then they start breaking and developing a like cells, which are like them. They're quite aggressive, and then they will be, they work so hard to start amassing all the cells around them. And then, so one cell will initially start, become two, and then you have a lot of them until you have a lump. And then these cells, as they are amassing and they're going, they can then infiltrate and get into the lymphatics. Once they get into the lymphatics, they can then go to any part of the body. So that is the process of cancer formation. So now, breast cancer is not any different. So the way it will happen with any other cells in the body now is the breast tissue that we're not talking about, and that's what happens in breast cancer. So it's an abnormal growth of cells that then becomes crazy, and then it then starts going to other parts of the body.
All right, we understand that medicine has been able to identify the genes that could be fingered to cause breast cancer. Okay, the BRCA genes and so on and so forth. Right. Now, how easy can this be diagnosed?
So I think since October is, the pink,
that's the breast cancer awareness month.
Yes,
October,
so, yes. Now, the BRCA genes, there are some genes in the body, because we can talk about, things that predispose individual to cancer.
Cancers.
And then cancers. And then there are different cancers, like I said, anywhere in the body you have a cell or different cells, those cells can go through that process that I described earlier on, and that's when you say cancer happened. So for different part of the body, we don't know the cause, but we know some factors that are associated with different cancers. So for breast cancer, for instance, One of the things is what you touched on, which is, family history.
Yes.
So there are genes that are actually typed to this particular cancer, and this gene, BRCA1, BRCA2, like you said, it's just that certain people carry the gene, and then that makes them prone to, breast cancer. There are other genes, not only
HPV and so on and so forth.
So we have quite a number of them. So once people carry such gene, they have the tendency to have the the cancer. There are other factors that are associated with breast cancer. We might touch on that now.
Quickly touch that. Anyway,
so we other things that are associated with breast cancer will be, there's a particular hormone that makes a lady, and that's we'll talk about estrogen. Estrogen hormone, wherever you have it, it's associated with breast cancer. That's why ladies are more prone to breast cancer.
Although it can be found in males as well, but very rare, right?
Yeah, about 1% of breast cancer is found in men. So now, when estrogen is produced, as long as anybody is producing more estrogen, the chances of them having cancer is high. So a lady that starts menstruation, once a lady starts menstruating, they start producing this hormone. So early period of starting menstruation makes somebody prone to it, because at that time you start producing this hormone every month, and that's why a lady have their period every month. Now, if a lady stay in that gap whereby when menopause happens, if menopause is delayed, that means that they produce this hormone for a longer period. So the risk goes up.
There's now more susceptibility to cancer, right?
Exactly.
Okay.
Now, apart from this hormone being produced in our body, it can be produced from outside. It can be produced in the ovary, okay, but it can be produced elsewhere. Part of that elsewhere is anywhere you have extra fat. So if a lady is adding weight, especially rapidly, if they add weight very rapidly,
so there's a problem.
There's a problem, because the extra fat will be producing more estrogen. Now, some ladies will take, contraceptions, hormonal contraception, which are combined, that has estrogen in it. That's what we call exogenous, a source of estrogen. So if you're taking such pills on a monthly basis,
exogenous means it's coming from outside.
Yes. So instead of the one that is produced inside, so it's produced. So that one now also increases the risk of somebody having breast cancer. Now, when a lady gets pregnant, the production of estrogen pauses. It stops, basically. And that's that. So a lady that had a child,
that's where prolactin comes in now,
prolactin comes in.
Okay.
Where prolactin comes in, progesterone comes in, there's a lot of hormone that comes in, oxytocin. There's quite a lot of different hormones that comes in there. But the bottom line is, when you get pregnant, then you reduce your risk as well. So ladies that have children, they reduce their risk based on the number of children they have. And then a lady that breastfeeds, this is very important, because I always encourage my patient that, look, exclusively breastfeed your child. It protects you, because what that means is, for the period,
and it's during that window of 6 months, you're doing exclusive breastfeeding without water.
Without water. So because anything that stimulates the breast, the nipple, reduces the amount of estrogen that you're producing. So exercise will reduce you being obese, and then you won't have excess fat. If you don't smoke, smoking is also associated with it, and so those are the things that are associated with breast cancer.
Okay, now we'll come back to some things that women can eat so as to reduce the possibility of developing those breast cancer cells in the ovarian. Okay, we'll be talking about that later, the green leafy vegetables and so on and so forth. But let's quickly, before we go on network news, now look at the preponderance of breast cancer in Nigeria. So just take about a minute or two to talk about that before we pause.
Yeah, so breast cancer, to make it easier, let me just put it this way. If you look at the next, say, 10 ladies with breast cancer in Nigeria, if you follow them for 5 years, you realize that only 1 or 2 of them will be alive.
Yes.
And then if you go to developed countries, UK, America, whatever, if you look at the next 10, it doesn't matter where they've been treated, whether here or there. You can change the patient, but if you monitor those ones for 5 years as well, you realize that about 8 or 9 of them will be alive. Now,
so why?
Yes, we can talk about that.
Yeah, let's talk about that within a minute.
Okay. So the reason, if I have to just go straight in there, is the fact that in Nigeria we do not screen our ladies. So the patient we're picking here, we're picking them when the disease is too
It's
late.
already going so
It's
bad.
because it starts from one cell, start multiplying, there's a lump, people ignore it, they start praying, they start drinking all sort of herbs, and they start rubbing things on
Hoping
it.
that God will come down and take it
And
away.
it will keep growing. And then they leave it further and leave it further. And then by the time we're picking them is when the thing is all over the place. They can come with bone pain, they can come with jaundice, they can come with things that is too late. But abroad,
so early diagnosis is key, right?
Is key.
So
abroad, they do this quite early, they pick. And then interestingly, just like you talked about the preponderance of this. Now, this breast cancer is commoner in developed countries compared to...
Okay, we're going to pause here.
Right.
You are still watching the Sunday Show on NTA Channel in Lagos. We shall go on network service.